Hello, YouTube world, my family, friends, colleagues, my viewers, and my subscribers. This is Robbie Williams, and welcome back to Rebirth. The segment I'm hosting today is on a very, very important topic, and this topic is about drug medication, how we administer it. Do we know or do we pay attention to the labeling of that bottle that holds those pills in? And today I'm talking about oral medication, the pills that are the tablets that goes in the bottle, and I want to talk about the labeling and how that is viewed and how we should view it. It is important because over the years and recently researched, nearly 250,000 people dies from medication error and medical errors. So when we look at medication alone, anywhere from 7,000 to 9,000 people are hospitalized. We have deaths due to people taking the wrong medication, people overdosing, hospitalization. When we think about that, those people that are inpatient and they are receiving their medications by assistance through a CNA or LPN or RN, and mistakes are made, it can lead to death or it can lead to permanent damages that's health related throughout the person rest of their life. We must pay attention to those things. We must educate ourselves, educate the people around us, pay more attention to what our family members or loved ones, if you want to call them that, what they're doing, how they're taking their meds. Are they reading the label? Are they making sure that they are taking the right dosage? Are they making sure that the label has their name on it? So what we're going to discuss today, and the topic is understanding your prescription drug bottle label. Okay, that's the topic. Understanding your prescription drug bottle label. So when I talk about that, I'm going to be using one of my old medications. I still just have an empty bottle here, and that's a bottle that shows you that I was taking diazepam for pain. Okay, I had dental work done, and that's what. But if you noticed on that bottle, you will see my name, you will see my address, you will see the doctor's name, which is the physician, or whom, whether he's a dentist or a medical PCP, primary care, general doctor, MD. You will see their names. If your name is not on there, you have no reason for taking that medication. You need to know who your doctor is, know him by name, be able to go and ask questions. This is important. These are the things you need to follow up on. Moving right along, in nursing and in any kind of healthcare administration or healthcare management classes, if you take any, or if you're working in that environment, you will hear about the 5 rights of medication administration. What that is talking about is the patient rights, the patient right to medication. So when you're looking at, as I said before, a bottle like that with a label on it, you should first of all look at the right. That patient, is it the right medication for that patient? How would you know? That patient name on the bottle. Okay? So, do we have the right patient? Yes, Robbie Williams. Do you have the right drug? The drug should say diazepam. Inside the bottle, it should be tablets, 20 count diazepam tablets. This is what we're talking about. That's the rights. Right time. It tells on this bottle 1 time a day. You would get that. So you want the right person, which is the right patient. You want the right medication, which is the name of the drug. You want the right time in which that physician will put on there what time of day you should take the medication. Then you want the right dosage. As I showed you my bottle, it states that 10 milligrams of diazepam. Take 1 tab once a day. That's what it says. So I'm taking 1 tab of 10 milligrams. Now, it's also wants you to use this medication and make sure it goes down the right route. The right route means either you're going to take an oral, which is you'll take it by mouth. If it's eye droplets, that's the other route. If it's an eardrop, there's another route. And so we're talking about tablets, so it will go orally in the mouth. Let's move further along here, and we're going to look at patient's name. When we talk about the patient name, if you look at this bottle, you'll see right at the top where you see my name. This is where, now this is a Walgreens label. If it's at Walmart, you'll see a different type of label, but it's structured nearly the same. So you're going to see my name. If I can get it here, you'll see my name. And right below that name, you'll see an address, physical address. Then right below that, the name is important. So why do they focus on the name in these 5 rights? Well, the reason why is taking the wrong medication can lead to, like we said, a long-term hospitalization or even death due to complications, adverse effects, different things. Because if there's a drug allergy that you have and there's ingredients in this drug that works against your body, there's your drug allergy. Now it says that you are allergic to that particular drug because of that one element, or maybe 2 or 3, who knows? But this is why they say, they have a list that they say, do you have any drug allergies? So you would tell them what drug that you cannot take under any circumstances. And then they record that in the records. It goes into the HIM, Health Information Management. And then from that point on, they know not to give you, anytime your name flags, they say, okay, this person is allergic to this drug. We cannot administer this type of drug. That's why it's important. That's one of the reasons why it's important. The drug name is very important because, like I said, when you living with someone, you're on one type of drug, that person on another type of drug. Why would you have all those drugs packed in the same medicine cabinet? You need to keep them separated. Husband, wife, separate the husband drugs from the wife drugs, medication, what I'm saying. And that way you will never get them mixed up when you go and reach in the cabinet to grab something to take. That's the important for the person name at the top of that bottle, on that label. Another important thing is the name of the drug. This ensures that patients know that what they're receiving, what they're taking, and this is what has been discussed between you and your PCP or whatever doctor that prescribed that. And you know, one of the main reasons why I like to mention that is because, for an example, if the husband is a diabetic and he's on metformin, and the wife, she has developed some type of heart problem, for an example, irregular heartbeat, well then she's going to be taking some type of arrhythmic type of drug, anti-arrhythmic type of drug, because of the arrhythmia. So having that type of problem, you got that drug in the cabinet, and if they share in the same cabinet, you got his drugs in the cabinet. If he reach up there trying to get his metformin and Miss trying to grab her arrhythmic drug, anti-arrhythmic drug, next thing you know, he may have an adverse effect. He may be rushed to the doctor in the emergency room by ambulance. We don't want that. We want to make sure that these drugs are separated and then people are doing what they're supposed to do. You know, the U.S. Food and Drug Administration, they get tons of reports, people reporting in, and it's up to like 100,000 a year where people have been given the wrong drug or taken the wrong drug, self-administered or administered by a caregiver or family member, what have you, even by nurses in the hospital. They get these phone calls all the time. And the National Center for Biotechnology Information, they did a study, and they have at it at 7,000 to 9,000 people dies due to medication error. That's giving somebody the wrong drug or not giving the drug as administered, as directed by or instructed by the doctor, by his orders. You have to remember, even the doctor make mistakes due to giving the wrong diagnosis, then adding the medication for that particular diagnosis that does not favor the patient. So these things happen. But when they get it right and you come home with that drug, someone, if you have poor vision, if your literacy level is not there, and you know you have proper reading, let me tell you something. It's not nothing wrong with asking for help. There's nothing wrong with it. Now when we get at people up in age, our geriatric people, a lot of them suffer from poor vision. A lot of them suffer from dementia. So there has to be someone in the family that's designated to go by and check and make sure. Do a pill count. When I was working at one of those nursing homes, like a senior living place, let me tell you something. I had a 42-bed house that I had to walk through and distribute medication. That wasn't an easy feat. And you have to make sure you give the right medication to the right person. So I had to show a lot of favor towards those 5 rights of medication administration. I had to show a lot of favor towards that because I had to be sure, I had to be precise. There was no time or no margin for error. Also, it was a review of 36 studies on caregivers' medication errors. And they found that rates ranging from 2% to 33% of oversights happening within that environment. And that's where you have the caregivers, whether they're CNAs or not, but they're just caregivers. They got these certifications, they became caregivers, and they care, and they're making mistakes. And we all make mistakes. Just, we got to bring it down to a minimum. Very low minimum. Because these mistakes can kill people. So, they found out that there was oversights, dosage errors, wrong medication errors, and administration errors, like how you administer the drug. So they found this out. And then the National Center for Biotechnology Information, they evaluated factors associated with nearly 430,000 patients with medication errors. And 17,338 of those medication errors had very serious adverse effects and even deaths. So it's important. It's important. So that's why I want to make it clear that the correct dosage, when you look at my bottle, you will see where it tells you the dosage right beside diazepam, 10 milligram. Then it also tells you how many, one a day. It say take one tablet by mouth, that is the route, every day. One tablet by mouth every day. So this is what you want to make sure you're doing. So I have a 20 count, if you look where the circle is, 20 count, and right below it says no refills. Understand that the only way I can get this bottle refilled is when I run out and I'm still having pain problems. I have to call my physician, make an appointment, or if he does it over the phone, he can do what they call an electronic e-strip. Send it in. The pharmacy will go ahead and prepare the drug for me for pickup. Then I just go by Walgreens, pick it up. Or he may ask me to come in because he may want to investigate the problem. So I may have to make a visit and get examined before he add another prescription there. These things are safeguarding everyone. I just talked about the quantity, the 20 count, which is important because if you have a 1-day dosage and you have a 20 count, that should equate to 20 days. Now, my pain may subside before the 20 days are out. Maybe in 15 days. Guess what? I got 5 pills later. 5 pills left over. That's fine. I don't have to have a refill. I don't need to go back to the doctor for that. You know, when he does his follow-up, he'll ask me how things going. I'm say, fine, no more pain. So that's one of the things that they do with that. Then it comes with instructions, extra instructions. If you notice on the side here, they got the fine writing, the fine print. This is where you get your warnings from. And this is what the FDA was pushing for. Making sure you put those warnings on them, like may cause drowsiness. Do not take if you're working with machinery. Do not take and drive. Do not take this medication when you're driving. So if you know you got to run to the store to get something, go get what you need and then come back and take the medication. You have a 2-hour window, a 1 to 2 hour window, depending on the doctor and the medication. They can do it. They can say, okay, you got 2 hours. if he set it up where he says this is a 7 a.m. and a 7 p.m. drug, but you have a 2-hour window, that's a 2 hour before the 7 and 2 hours after the 7 that you have room to play with. And what I mean by that is you can take this med at 5:30 a.m. in the morning if you want to, given that 2-hour window. If he give you a 1-hour window, you can take it at 6 a.m. in the morning, even though it's a 7 a.m. med. Same thing about after. If you forget to take your med at 7 and here it is a 7:45, no big deal. Go ahead and take your med. But if it's 9:30, you need to call and consult with your doctor first. Consult with your PCP or the doctor that prescribed this medication. You consult with them first because you're way too late. Now, it also would tell you on this bottle, it would also tell you whether you can eat or drink with this drug. Now, for this particular drug, I was given a warning not to eat or drink grapefruit or grapefruit juice when I'm taking this drug. And it's written right here in fine print. But if I didn't read that, because I love grapefruit juice, because it helps the body anyways. So, you don't want to do that. You want to make sure that you're reading the label. That's what this video is about. Pay attention to this label. Understanding the label on your medication bottle and knowing what it says. When you get down to those side effects, the most common and the most important thing is that you want to make sure that the medication you're taking has the instructions that you need, every instruction, that you know those instructions and you know those side effects, because there are some drugs that, like I said, they're dangerous to take in their operate equipment. You cannot take them and drink alcohol, or you cannot take them with another type of drug. So your doctor would tell you this, and it should be in your patient summary as well. And they give out patient summaries after they finish. You leave out, you have this patient summary that you take with you. And when you do go get your prescription, you will also have what you need. Expiration date. Make sure you pay attention to the expiration date. Because after that date and you haven't taken all the pills in this bottle, you need to discard the pills. The best way to do it is to go into your bathroom, take the top off, and pour them into the commode. You pour them into the toilet and you flush. Then you can throw your bottle away. It's not good to throw a bottle of pills in the trash can because it goes into the dumpster and people dumpster dive. And a lot of homeless people do that. And they dumpster dive and they get whatever they can. If they see pills in there, they're going to see what they're going to explore. You're not going to stop that. They're going to explore. Last but not least, I want to talk about another important name on the pill bottle. Like for mine, it's the doctor name. And it runs right across from where it says 20 count, no refills. And as I go around, it says doctor authorization. And then it gives the doctor name. That's another important name. So those are the two most important names on your pill bottle. Your name and the physician that authorized the drug. Remember that. Listen, people, these things are very important. Medication error is happening. It's happening even while we speak right now. You're not going to avoid that. It's going to happen. But the way you slow it down is educate yourself and start taking the necessary precautions. Don't forget, when you listen to this video, click on the subscribe button and the notification bell. Also, be safe, be blessed. My name is Robbie Williams, your host from Rebirth, and you have a wonderful day.